I'm Arya Fala. I'm a pediatric neurosurgeon and an epilepsy neurosurgeon here at UCLA. I'm the director of pediatric neurosurgery. A hemispherectomy is an operation where an entire half of the brain is either physically removed or disconnected. And it's commonly done for children that have drug-resistant epilepsy. So these are seizures that are not responsive to medications, and the only treatment for it is to remove that abnormal hemisphere of the brain. So the reason why we like to do a hemispherectomy as soon as possible in kids as young as possible is because the brain has the most ability to rewire itself. So typically there's two ways to do a hemispherectomy. The more traditional way is to do an anatomic hemispherectomy, which really means to remove the entire half of the brain that's abnormal. But nowadays, what we typically do is something called a functional hemispherectomy, which involves removing a much smaller portion of the brain, but really disconnecting the rest of the brain. So even though it's residing still inside the skull, that it's functionally disconnected. So a hemispherectomy surgery does sound like a pretty scary operation to undergo, but it is an operation that's been around for many, many decades. And here at UCLA, we're one of the pioneering institutions in the country and in the world that have been doing this operation. So at select centers where this is done very frequently, this surgery is very safe, very effective. If your child needs this type of surgery, you know that beyond the recovery phase of the surgery, you're giving your child the best life in terms of seizure freedom and not allowing the seizures to overtake the brain function. If the seizures are left untreated over time, they will take over more and more of the function, so the child falls further behind in terms of their milestones and their development. What epilepsy is, it's really recurrent seizures. So these are seizures that are unprovoked. So for sometimes a few seconds or up to a minute, the brain is really hijacked by this abnormal electrical surge that occurs, and it really interferes with a lot of the function of the brain, such as learning or memory. So the good news is about 2/3 of all patients with seizures will become seizure-free with medication. But there's a sizable group, about 1/3, that will not become seizure-free despite any medication trial. So very quickly, especially by the time the second medication fails in treating the epilepsy, we want to think about surgical options. Nowadays, we have a lot of different tools that are very effective and much more effective than more medications. In terms of outcomes, the vast majority of patients become seizure-free, depending on the underlying reason why the hemispherectomy is done. It could be anywhere from 60% to almost as high as 95%. There is a subset of children that may continue to have seizures, but they're typically not as frequent and not as severe, and sometimes more manageable with just the medications alone. So as you can imagine, one of the biggest questions families have with this type of surgery is, will it work? How effective is it? And can I predict that possibility of seizure freedom? What we did with a few of my colleagues around the world is we got together and we designed a HOPS study. HOPS stands for Hemispherectomy Outcome Prediction Scale. This is where we really put together all our data, not only from UCLA, but really from many centers across the country and across the globe. And we collected data on over 1,000 kids who've had this type of surgery. And we really look for factors that are most predictive of the outcome. So now with HOPS, it's possible for your clinician or your clinician team to really personalize and tell you the probability of seizure freedom with a lot more accuracy, based on the characteristics of your child's seizures, based on what the imaging looks like, what the PET scan looks like, and so on. So nowadays, we're able to predict this with a lot more accuracy. Here at UCLA, we have a very large multidisciplinary team We have the tools, we have the latest technology, we have the latest operating rooms that really allow us to stand out and be a leading center for epilepsy care.